I had pulled our 2 winners from last week that we'll have. And it is showing me that we're live. I'm just going to check here on Facebook so we can give our followers a quick update that we are live and getting started. And for those of you that do end up hopping on here in a minute, please give us that thumbs up. Let us know that you can see us and hear us fine so we can get going. Oh, interesting. I don't know if you can hear like the sirens on my end over here. It's like I'm just gonna wait until they pass so I can start.
Don't be started.
All right. Well, let's get going. That's probably one of those complaints we were talking about. So good morning and happy Monday to everyone. I hope you had a terrific 4th of July weekend and spent it safely with family and friends and those that you love. If you're hopping on with us, give us that thumbs up. Let us know that you can see us and hear us fine. Give us comments and questions in the comment section of this video. Thank you, Peter, so that we know that any of those questions or comments can be taken up at the end of the broadcast with our mayor. He'll be answering those toward the end. As you all are aware, we host these videos every Monday with our mayor to give an update on what's going on in our city, things that are going on in our community, and just tips that you should be aware of, whether you're a resident or a business owner. All of our videos are available to you at any point in time to watch on replay here on our Facebook page, on our YouTube page as well. And then we're on all social media platforms, Twitter, Instagram, at Westy Chamber is the handle for those. So before I go ahead and get started, I just want to share, if you're new to our page, make sure that you like the page, that you hit that follow button so you can get the notification alerts whenever we do go live. So that way you're notified and know in time what's going on. And then if you rewatch these, give us that hashtag replay so we know which of the videos that you enjoyed as well. Hello to you, Emilio. Hi to Jack as well. Thank you guys for hopping on with us. I will now mute myself and turn it over to our mayor, Mayor Herb Atchison, to share a few words.
Well, good morning, everyone, and thank you for joining. Hopefully everyone had a safe holiday, and I doubt very seriously it was quiet. I know Juliet and I were talking about the number of calls that the local police departments all around the community had with violations of fireworks. I know I was telling her I have never seen so many large fireworks displays in residential neighborhoods that I saw from my deck on Saturday night. Hopefully no one was harmed, but we do know that there were some places around the metro area that had buildings and homes and fields and other things that unfortunately were damaged through fire. I want to talk a little bit about where we're at today, especially around our COVID activities. So effective today, under the governor's order from last week, we're going to be potentially moving, and I said potentially, moving to what's called Protect Our Neighbors. It is an expanded reopening of about around 50% without caps, as local outbreaks are managed by strong local systems. Larger gatherings are okay, but mass gatherings are prohibited until there is a treatment or vaccine. An example of one of the things we saw this weekend was Bandimere Speedway. Even though they were under a court order not to exceed 175 people per stadium section, I would tell you to go online and look at the thousands that were in each of those. And now the court and Jefferson County Health are going to have to deal with the outfall of the violations with Bandimere. Let's talk a little bit about what the order that is going to affect our businesses and our restaurants and all of us who work and play here in not only in Westminster, but the entire metro area. One of the things it talks about, there's 3 big pieces. One's the healthcare system, that we need to be able to show that we have a strong public health system plus additional healthcare capacity. These are the keys to reopening the economy. Under Protect Our Neighbors, we must be able to show that we have a low virus prevalence, we have a healthcare capacity to handle a surge, and we have a strong public health capacity to contain outbreaks and surges locally including the ability to test, to track, and to trace. Now, in order to qualify for protecting our neighbors, there are 8 stages that you have to be able to validate. First and foremost, there has to be a sufficient hospital bed capacity within your community. There has to be sufficient PPE supply. You must have a stable or declining cases of COVID-19 hospitalizations. There have to be fewer COVID-19 cases. There must be sufficient testing capacity. You have to have the ability to implement case investigation and contact tracing protocols, to document surge capacity plans for case investigation and contact tracing. And finally, in this piece of it, strategies to offer testing to close contacts of outbreak-associated cases. The big piece of this, which drives all of it, is the ability to move exceptions or variants is going to be moved from the state down to your county health department. Now, for Jefferson County, that's within the Jefferson County Health Department. For Adams County, it's under Tri-County. There are 5 major pieces to this one. The mitigation plan that is to be submitted by the health department to the state has to, number one, actions that will be taken if they fall out of compliance with the metrics. How will counties promote public compliance with the guidelines? How counties will increase mask wearing in public settings? How will they increase influenza vaccine uptake as we approach the flu season to ensure we don't lose healthcare system capacity needed for the COVID-19? These plans must be approved by local elected leaders, including county commissioners and mayors, the hospitals that serve the county, law enforcement, emergency management, the local public health director, and, if applicable, tribes. Now, a number of states are moving to mandated face coverage at all times when in public settings due to the huge numbers of increased COVID-19 positive cases. Some of those are Arizona, Texas, Florida, and California. Now, locally, along with several counties, Aspen has moved to mandated wearing of face coverings along with mandated early closing of restaurants. The failure to comply with these directives can cost the business its license along with a fine. Businesses must mandate face coverings to all people entering their businesses in those counties that have taken this stand. Gilpin, Clear Creek, and Summit are the only counties that I have any information regarding their move to this, but several municipalities within those have already moved to the point of telling businesses, if you don't comply, we're going to close your business. Unfortunately, we still have people who are of the opinion that face coverings don't do anything or they don't want to wear them. But the important part of those not wearing it, if you have a health issue that prevents you from wearing one, please be assured no one's going to mandate you wear a mask that will affect your health. But we ask you to be vigilant. If you can wear one, that you're not doing something that's going to spread this worse, and that Westminster, among many others, does not want to go backwards. Now, we've asked our health department in Jefferson County last week on a call between the mayors, commissioners, and the health department how soon they thought they would have this mitigation plan put together, and it could be a couple of weeks. But the bigger part of this is, how are you going to validate businesses, restaurants, whatever, going to a larger capacity? As an example, if you have a restaurant today, you are aware that 50% or 50 people, whichever is the smaller number, is what you're allowed to have. If we want to try to help you get to a larger capacity, this mitigation plan is going to have to be in place. But not only that, according to the health director, they're going to have to come out and validate every business. My question to them is, how are you going to do that? With the limited staff that you currently have, how will you go out to each business and validate what they are able to move up to? Right now, they don't have an answer, because we know they don't have sufficient staff to get all the restaurants and all the businesses within the county inspected in a timely manner. We don't have any guidelines from them as yet as to whether or not they're going to call on local officials or local departments within the cities to help out with this. Likely is that if they do, it would have to come out of either our code enforcement or our building departments, because we don't have people that typically go out and inspect businesses other than in those two departments. But we don't have people who are healthcare experts to go in and make those evaluations. So that still has to be worked out. So there's a lot of things that are now in play with trying to get the ability for us to grant businesses higher capacity or variances, moving down to the local healthcare department levels. But again, until our mitigation plan by the health department is put in place and approved by CDPHE, we still have to go to the state to get those variances approved. The indication was, as many of you are aware, the governor reinstituted the closing of bars and nightclubs last week, putting them back on a hiatus that you can't be open. However, the exception to that is if a bar or a nightclub has restaurant service connected to it, then they can open as a restaurant and that put them back in business. But still we still have early closings that are going on. So there's still a lot of ambiguity about what's going on and how much we can do as far as we can. Luckily, both Adams and Jefferson County's infection numbers are at a small number, still going up, but at a small number as compared to other parts of the municipality. With a lot of the gatherings that took place over the 4th, we don't know how soon, if any, impact that will be to our healthcare systems or to the rising numbers. It'll be something that the health departments will have to continue to watch. Juliet, that's unfortunately what we've got on our Protect Our Neighbors, and we are evaluating it as much as anybody else to see how soon, what can the cities do to help the health departments so that we can get to this ability for the local health departments to be able to manage this other than having to consistently go to the state.
Well, thank you for summarizing a lot of that. I know when the governor came out last week and shared this, it was definitely hours long. So you hit the key points by really taking and highlighting out what that looks like, what the phase looks like, what the possibility is for potential counties to move to, because it's not an immediate statewide measure that's been implemented. It's if those criteria are met and if they have precautions in place that don't result in a spike in the community. We've had several folks that have popped on during the start of your broadcast. I just wanted to give a quick shout out to our chair, Brian Dice. Hello to you, Parker Brown, Melissa Snyder, Dave Carpenter, and of course, Wayne Anderson. Thank you for your comment. He's sharing, good morning to myself and you as well, Mayor. So we did have an initial couple of comments and questions. The first one was both are from Peter initially. So Peter touches on no large events until a vaccine. That means no large concerts or sporting events that we could be years away. And from what I've heard most recently, Mayor, and you could correct me if you've heard something quicker or differently, but there are several different pilots that are going on right now in regard to a vaccine and predictions that may be as early as this spring.
I would know as much about it. We had a conversation about a week and a half ago with a number of our pharmacy and large groups talking about when they thought vaccines might be available. So I would say that based on what you talk about with them, you might see some early signs by the end of the year, but it's more than likely spring of next year before we see anything that's going to be mass produced for vaccines. And then it's going to be how soon can you get that vaccine out to people. The one thing they did confirm the vaccines will not be nasal sprays of any kind. They will have to be injections.
So this next one is in regard to our hospital beds that are located around our community. What is our capacity in the area for hospital beds? Are you aware off the top of your head?
Actually, I still meet on a bi-weekly basis with all of our hospital CEOs. So that's Health One, Centura, Vista, and SCL. Almost forgot them. So basically, if you don't know where they are, that's Good Sam, St. Anthony's North, Health One, which is North Suburban, and then Avista itself. So those are the ones that primarily serve our community. As of last Thursday, there were less than 10 positive COVID patients in all four. So that was pretty good. And there were only about 2 that were on ventilators. Capacity wise, because they have returned to elective surgeries and stuff, they are doing more of that now, which if we saw a big surge, and then the electives would have to be put back on the back burner. The big thing I think that most of the hospitals are concerned about is that people are delaying going in when they have symptoms of something other than COVID. And I'm talking about strokes, heart attacks, those kind of things. People are delaying and potentially putting their lives in jeopardy by not going in when you're having those symptoms. So even though we have COVID still around, we don't have it in large numbers in those that serve Westminster. But I would caution people not to avoid seeing their doctors if they are having some kind of a health issue. It doesn't mean you necessarily have to be hospitalized, but get in and see your doctors when you need to.
Absolutely. And I think that, that's really a reaction earlier on. It was stay away, especially if your immune system is compromised, if you have things that are underlying that may increase your risk. And so you did see that fear of, well, if I'm not feeling that great and if it continues to get worse, I'll just hold back because the likelihood of me contracting something that's so unknown as opposed to what I might have is substantially greater. So I'm glad you shared that as well, Mayor. It looks like we have, I like that you clarified about bars and nightclubs. Those have been closed as of last week, unless it's the restaurant component that's incorporated in there. I thought that was great for you to highlight. Hello, Lalinia. Thank you for hopping on as well. So this is another comment that I have from Peter. And so Peter is sharing his sentiment that as a business, when you do make it a mandate that they have to either require these masks or that we would send somebody in to put in a fine, et cetera, that is an overreach onto the business's boundaries. What can we do to influence this? And probably another way that I would word this, Mayor, because I feel like this could have been a little bit worded differently, was, the concerns aren't necessarily from the business. The businesses are doing their best to institute health and policies in place. They've put up the signs. We've heard it. I know you've heard it as well, of people still dismissing it, and then them standing their ground and then having some sort of retaliation later on. So it's really more residential corrective. But again, it falls onto our business communities in this instance because they are the ones that would be fined and somebody would be sent in. So what can we do to help overcome this potential situation that we might see a spike in affecting our businesses adversely?
Well, I think what I need to do is all the parameters of what are laid out for you today. If you're in the service industry and your employees are essential, you're already requiring all of your employees to mandate that they wear face coverings. The city took the stand and issued an order that mandates, if you're going into these, that you should be wearing masks or face coverings. However, not everybody is a business. You may have put up a notice, but you're not necessarily reminding the customers of that. Now, there's ways to do it that you don't offend the customer. This is not something you're going to start a big fight over. But if you have a problem where you're asking people to do it and they're refusing to do it, you have the right as a business owner to tell that customer you don't want them in infecting your business. But at the same time, you have to understand, as I said earlier, not everyone can wear a mask, and we understand that. So if someone tells you that they can't because of a health concern, then take their word for it. I'm not going to go question them, and I don't think you are. The big thing is, if we're not showing through our own demonstration that we're trying to do everything we can to stop the spread of the COVID-19, when the health department gets ready to submit this mitigation plan, we're going to have a tough time getting it approved through the state. So we need to do everything we can under the guidance that we have today from the health department. The city already has the mandate in. There's Westminster, Wheat Ridge, and I think Golden are the three cities in Jefferson County that have this up already. We are not making this criminal. We're not going to do that. If we're giving you the authority to help you control that interest to your business, so it's up to you. But I would ask you, please make sure that we're doing the social distancing, do the cleaning necessary, do the disinfectant you need, encourage your customers to wear a mask and face coverings as much as they can. That's the way we're going to keep the COVID numbers in Jefferson and Adams County down. If we don't do that, then we're likely to be a long ways from getting the mitigation plan approved.
Thank you. And then this next question comes from our board chair, Brian. Brian's asking, can buyers incorporate food trucks to stay open, or do they have their own kitchens?
I think in the past, what they have done, and Brian, thanks again for clarification, but I believe that if you have food service as a part of your business, whether it's in the building itself or you send them out on a patio or something, as long as you have that food service, it's my understanding, and I would tell you, don't take this to the bank because it'll be up to the interpretation of the health department, not Herb Atchison. That had been allowed in the past. I think the big thing was if you didn't have food service there, then they were not considering you a viable restaurant, so you could not reopen. I would refer you primarily go back to the state's interpretation of that to be safe and not do something that you're going to get in trouble with.
And I concur with your statement as well. Peter says so we have no issues on hospital beds in our area. That's good news. Yeah, awesome. Anything else on your radar, Mayor? I know we didn't have, so we had 5 weeks last month. So we're picking up the study session, I believe you shared with me earlier tonight. And then next week would be city council. I know there have been a couple of comments that you and I have kind of sidebarred on. There was one that we had from, and this wasn't really on this broadcast, it was on another promotion that we had done, but it was a resident expressing frustration and lack of being able to support our local businesses. Where was that note? Due to our water bills being too high. So that was one comment that we had received. And then another comment that we had was asking, how our facilities are going, which ones are open, which ones aren't, senior centers or not, swim and fitness.
Well, most of these city facilities are still closed. And until we can safely make those and we can get the ability through this quote mitigation plan that we're going to be doing, you'll probably still see some of that. A decision was made last week that Countryside Pool would be reopening, but with a very limited number of people allowed in. And we still have to do the social distance and the cleaning with that. City Park, some of those areas we're still not reopening at this point. To the one comment you referred to, I'm not sure how water rates have anything to do with shopping at local business. I don't get the tie in there. If your water rate's high, then you need to check with the Public Works Department to find out why your water rate is based upon how much you're using, not just the cost. But if you've got a problem with your usage going up, you don't understand why, call the Public Works Department. We will send people out to help try to investigate why, but we will also do a records check to see what you were using. Keep in mind, there's a lot of people staying at home now that are using more water than they would in normal situations. Some meters have been changed to the new updated meters, so you may have been getting a break that your meter wasn't accurate before and you were getting water that you weren't paying for. So that's another option. But also with the weather, people are using more water because they're home more. I don't know that we've seen the huge rise in our temperatures until this week and next week. We're going to see potentially by the end of this week, triple digits. But I don't know that we've seen a huge amount of irrigation going up that wasn't already there. But again, if you have a question about how much water you're using and why, contact the Public Works Department. We have people waiting and they will be glad to come and try to deal with your questions.
And then Mayor, I know that we were talking before this as well, and we shared that our mini grants have been dispersed funding wise. And so we're reevaluating kind of our financial options and what else might be available to our businesses. Are the grants that you all have opened to help with operations in our community, are those still taking applications, or?
I believe all of them are good through the end of the month, as I recall, Juliet, because there's like 3 different grant options that are playing around right now. That's just within the city, but then you also have the one that's partly with Adams County, who they are controlling. So I've had no feedback from them on what they're doing. Hopefully we'll see some. If you have the opportunity, you'd like to stay up late, tune in tonight, and we will have some of the COVID updates from the staff that'll have some better updates on current numbers as to where our different programs are at and how many applications or how many grants we've had. So hopefully we'll see good updates on those tonight.
Absolutely. And grab your coffee, grab your popcorn. It generally is a longer period of time.
And it's cheaper than a movie.
Yeah, it is. It is. It's one of those Bollywood type of 3 hour long movies that you could probably find. Well, terrific. It sounds like we touched on a lot of things. Before we close out this broadcast, I just wanted to highlight we gave away 3 winners for our Westy Rise Shop Local program that's in partnership with the City of Westminster and the Westminster Chamber. We started this on June the 5th. We are actually running it until the end of July, so July 31st. Details are at westminsterchamber.biz. If you go to the events calendar, you'll find the Westy Rise program, and there's a click-through banner that's rotational on the home page. We also launched our app. Mayor, hopefully you've started downloading the app. It's under My Chamber app. If you download it, it actually will pull up based on your location. So here in Westminster, it's a free app, but it shows all the businesses here in our community separated by category. So it makes it a lot easier for you to put your dollars locally when you can. And this is only an app that's available during this program. And then the last thing I wanted to highlight, we did draw out 3 winners, and this is not in the prize order, but I will contact each of them individually so we can take your photos, post them out, and give you your prizes this week. Our 3 winners from last week were Christy Douglas, Parker Brown, woohoo, and then Linda Taniguchi. And Parker, it's a good thing you didn't win the week before last, because one of the prizes came from Carrabba's. Would have seemed a little bit sketchy if we'd given it to you. But congratulations to all 3 of you, and thank you for submitting in your receipts. There are many ways that you can enter, super easy for just supporting local. So make sure that you go to the page to find out details. All right. Well, Mayor Atchison, I have nothing else, and it doesn't look like we have any additional questions. So you're getting off easy, I feel like. But that doesn't mean that if you end up watching this video on replay, give us the hashtag replay or send us a comment later on. I know sometimes whenever we're off, we see more comments or I get some DMs, and we are able to share that with the mayor and get you some answers. So make sure if you do have any questions that you let us know what those questions are. There's comments and concerns, information share so people know what's going on in the community and what broadcasts the mayor has shared with us, what updates the mayor has shared with us on the broadcast this morning. Thank you to the mayor for doing these updates. We have that from Peter as well. And then we'll be back here tomorrow at 11 a.m. with a business success series. As you all are aware, we've been doing these at least once a week where we highlight a business. So we have one business that we'll highlight this week, another nonprofit corner, and then we're concluding the week out with a U.S. Chamber partner so that they can share kind of some of the programs that we've been working on, COVID and racial issues and things like that. But thank you so much to every single one of you for tuning in, and to the mayor for taking time out of his morning every week to spend it with us. Thank you.
Have a good day.